Hey everyone, my name is Merdad Hariri, and I'm a program director with RX Connection. In our part three of Men's Health, we've got no other than Greg McKetry that has been presenting this interesting topic, and certainly I've learned quite a bit from everything that he has discussed in the last two uh, parts, and this is the last and final part of this presentation. There's a lot of good stuff in there. I'm sure that you can use this knowledge to, provide a better care to your patients. Um, and as you know, we have RX Connection. RX Connection, we provide a telehealth program that can help you, you know, generate revenues for your pharmacies that can truly make a difference. So I think what Greg has to talk about kind of goes hand in hand with what we provide with the telehealth and everything. So, Greg, I think it's 1 o'clock. We can go ahead and get started. And as I see more people coming in, they had a lot more people than this, but when they do come in, I will let them in. So, go ahead, Greg.
Absolutely. Thanks, Medad. And thanks everybody for coming out. And as Medad said, this is the third installment of this presentation, and we've covered a lot of information from the etiology and background information regarding sexual dysfunction in men through a lot of the different treatments for erectile dysfunction and sexual dysfunction. And as Medad said, this is a tool, and I think it's very important to understand that through avenues like RX Connection, there's something that I learned a long time ago. I don't have to be an expert in everything, but I do have to know the best access to get the information. So, being able to pull in resources where you can apply that to your practice and benefit your practice really can pay dividends. So, that being said, again, today we're going to start back off where we left last week. For those of you who are with us, again, we were covering a lot of the treatment modalities for erectile dysfunction. Today, we're starting with honestly, probably the most common and largest component of erectile dysfunction, which is premature ejaculation. It actually affects more men, the percentage wise, than any other form of or snippet of ED in general. So PE or premature ejaculation really does have kind of a complex nature to it. It's not a quick fix for most guys because there are really two sides and two different pathways. One is a psychogenic factor. Um, and this can be something that is newly acquired. So when we talk about this, we're talking about the psychological aspect involved. So, it could stem from performance anxiety, developmental within, the process of maturation, more immediate, like a current or very recent partner experience. And this involves a lot of different things. And, it can be due to the anxiety itself. It can be due to lack of awareness of sexual technique. It can be due to, being in a hurry or inexperience, or the fact that, maybe sexual activity just isn't very frequent. There can also be the high level of arousability, and, then it can feed into some of the other psychological aspects. From a biological standpoint, and this I find to be really interesting, there's actually a hereditary characteristic to premature ejaculation. And this has been studied and documented, and literally and truly showing that there is a connection in familial traits. So much so that in doing studies with twins, it was revealed that the genetic effects accounting for a high variance in premature ejaculation could be tied directly into this genetic characteristic. So this may be something where there's just a hypersensitivity It could also be in the endocrine system. It could be nutritional. It could be due to neuropathies. It could be due to other medical conditions. But again, the big factor here is that there's both a biological aspect and a psychological aspect to premature ejaculation. So the treatment of premature ejaculation is something that is interesting because it really covers a wide scope, everything from behavioral modifications through the use of medications and even into surgical interventions. The most common and really first line approach are using the behavioral approaches. So there's a couple things. Stop and start technique, basically during sexual activity, as the arousal hits a point where climax is imminent, stop, just pause, allow those sensations to abate so that again you can kind of get back to the activity without that impending climax. The other is a thing, it's called a squeeze technique, which it's similar to stop start, but this actually has the added physical capacity where as the man is sensing the impending orgasm, you pinch the penis, and this actually shuts down the response. And again, similar to stop start, it allows you to basically take a break and then get back to activity. And another behavioral modification that is commonly used is pre-sexual or pre-date masturbation, basically just desensitizing by removing that sense of urgency and getting the initial climax out of the way. The drug therapies or pharmacological therapies very commonly, and what I'd like to point out is the medications that are used to treat PE are typically the medications that cause ED. So kind of makes sense. So SSRIs, we all know that SSRIs for both men and women have a very negative effect in terms of sexual function. For men, they have a tendency to retard the ejaculatory response. The problem with them is that they really have to be taken on a daily basis. So you have to look at the patient and determine, does the condition warrant the use of a daily antidepressant, an SSRI that they're going to take every single day? And the potential side effects that can come along with that, and it's just really, is this something that is the best avenue? There are other options. As opposed to the SSRIs, the non-selective serotonin reuptake inhibitors, in particular clomipramine. Clomipramine actually works a little bit different. It can be taken like the SSRI on a daily basis, but it has actually been shown, unlike the SSRIs, to work on an on-demand basis, which means you can take it a few hours prior to sexual activity and you have a significant increase in the amount of time prior to ejaculation. Other agents, numbing agents like benzocaine, lidocaine creams or wipes or sprays, even they make condoms that are lined with benzocaine to reduce sensitivity. Surprisingly enough, for a lot of guys, PDE5 inhibitors, taking things like Viagra or Cialis, can actually allow them to delay orgasm. And some of this may fall back to that psychological factor, because if they have it in their head that they are going to have a problem with performance and they're rushing through the process and they're nervous and they're anxious, giving them that confidence to be able to perform a lot of times can relieve the issue. Very similar with penile injections like the Trimix or Edex or Caverject. Other things that can work, commonly used, is tramadol or opioid agonists like that, which is very effective, especially when we combine it with things like the PDE5s. Of course, the negative with tramadol is it's a controlled substance. So, you start running into some issues with that. Alpha adrenergic blockers can help. And I mentioned the penile injections, which not only can they help with the performance anxiety, but because of the way they work, A lot of men are able to maintain the erection after the first climax, which this plays into both sides in terms of the biologic and the psychological, simply because you're not overcoming the initial climax, but you start to build up the confidence, and that performance anxiety goes away. So with practice and with using them, a lot of times they're able to actually sustain much longer. And then here at the bottom, what you're seeing are kind of the graphics in terms of how much benefit you can get from these medications. And again, the IELT, that's how much time from the insertion of the penis into the vagina until the climax. The daily SSRI, and the best one that we've actually found in studies, has been Paxil or Paroxetine, which shows when taken every day, and we're talking about 20 milligrams a day, 11-time increase in the time for intercourse. Taken PRN or just as needed, we're talking about maybe 2 times. So again, you can see a significant difference there. With the clomipramine, daily, again, very good, but even the PRN, which we recommend taking about 4 hours before sex, an increase of 4 times. That's substantial, and obviously much better than the SSRI. And then again, as I mentioned about like the tramadol, combining these with other therapies like the PDE5s can be even more beneficial. So, as I had mentioned, psychological influence is a huge factor that, again, goes a long way, especially when you're starting to see some benefits from the pharmacological side. In my opinion, use of daily medications for this, unless there's justification, I just don't like it. Certainly, in some cases, it actually works in the overall benefit of the patient if there are other issues that are underlying. I'm again a big fan of using the least intrusive methods. So try the behavioral modifications first and work your way up from there. The medications, again, as I mentioned before, the PDE5s and the penile injections, they boost the confidence level. They reduce that performance anxiety. So again, if it is really more of a psychological influence, these can have a huge benefit for the patient. And then lastly, incorporating these different techniques, incorporate the medications, incorporate the behavioral modifications and the exercises, and use these in terms of the full aspect, how we can best benefit the patient. And again, these are things that's very easy to convey. Obviously, it's a very sensitive conversation, but none of this is real complicated in terms of the medications involved. So, delayed ejaculation. Now, this is the opposite, obviously. Delayed ejaculation, or another term, or slightly different, anorgasmia, being the inability to climax. It's also known as retarded ejaculation or inhibited ejaculation. It is far less common than premature ejaculation. As I mentioned, premature is the number one, is the most common form of erectile dysfunction. But just like with premature, the performance anxiety and psychological issues can play a role in the delayed or anorgasmic situation, especially when the impact becomes really damaging emotionally to the well-being of patients and partners. And this is something that we see a lot of, where you start getting into a situation where partners are blaming themselves or questioning the patient, thinking that I'm not enough for you, I don't excite you, you're not interested in me, when in fact this really is a medical condition. It can be something where it's acquired due to injury, due to new medications, or it can be something that persists lifelong due to neurogenic conditions. As I mentioned, certainly the psychological issues can contribute, and medications big time, injuries big time, surgeries big time. The FDA has approved a grand total of 0 treatment options for delayed ejaculation. So here's where this kind of knowledge can come in really handy, simply because you can't go to the doctor and really get an answer about what's going to fix or help the problem. There are some links that tie in, and we do see some associations with hypogonadism in terms of delayed ejaculation, where there's a higher prevalence of patients who have low testosterone tend to have issues with delayed ejaculation. Conversely, patients with very high testosterone tend to have more issues with premature, which makes sense. You think in terms of that excitement level, and that really does make sense. So again, there's a point that can be easily conveyed to your patients. So, how do you treat it? If we really don't have anything that is approved, what kind of things can we use? So, as we mentioned, if there's a low T issue, boosting testosterone levels, whether that's using testosterone injection, topical, the SERMs like enclomiphene or clomiphene, HCG or Pregnil, even aromatase inhibitors can be significantly beneficial in terms of boosting that testosterone level and helping. Again, higher level of excitement due to the drive from the testosterone can be very beneficial. Cabergoline, which I've used a lot in the past, it's a D2 dopamine agonist, but it really helps by reducing the prolactin levels, which, in terms of the male of the species, when you climax, the body releases prolactin, and that's what makes everybody get sleepy. I don't care if you're a man or a lion. If you reduce that prolactin, you boost the ejaculatory capacity and the rebound capacity. So, this is something that can help to, again, kind of stimulate that excitement level and boost orgasmic function. It's, again, a pretty simple mechanism. One tablet a couple of times a week is really all it takes. One of my favorites is oxytocin, which they call it the cuddle hormone, and it is involved literally in every aspect of sexual activity, everything from penile erection to ejaculation to overall sexual satiety. It is very rapid onset. It's rapidly metabolized, so it's something that can't be taken as like a daily drug. It has to be used immediately prior to sexual activity. And because of that, we use rapid absorbed forms, dosage forms like nasal sprays or sublinguals that get into the system very quickly. It can be, and it has been tested with injections, but again, for majority of patients, that's probably not going to be the best way to go. It's just, again, it's a great drug because, again, it boosts the feelings of intimacy and sexual awareness. Yohimbine, which I'm old, so guys, guess what? I remember when we were prescribing Yohimbine for ED back before Viagra. So not only does it help with vasodilation and have pro-erectile functions and pro-ejaculatory functions. So it really combines to help with performance and ejaculatory or orgasmic capacity. One of the things with Yohimbine, people took very high doses and they had some side effects from it. So what we try to see on an average are doses of about 20 milligrams a day. As you can see in the studies, doses between 10 and 50 milligrams in patients with delayed orgasm showed a 55% increase in orgasmic capacity in response time. So in addition, since again, this is a very complex issue, human sexuality really is comprised of 4 different components. Libido, which we've talked about with testosterone and arousal. Again, that's both testosterone and with the oxytocin. The orgasmic function, we've kind of discussed that, especially using features like the Yohimbine. And then the resolution, which is satiety, again, coming back with oxytocin type. So, some of the medications that we use are to target particular aspects of this, like dopamine, that impacts sexual desire, it impacts libido. Acetylcholine impacts arousal and erections. GABA controls orgasmic function and release. And serotonin is the good feeling and the refractory and the sexual resolution and satiety. So how can we stimulate some of these different aspects effectively? Well, one thing that I have found is that CBD products, cannabidiols, actually do a great job with this. CBD supplements, again, guys, this is something that most of you probably have on your shelf. They can stimulate the serotonin receptors, oxytocin receptors, anandamide receptors. Anandamide is called bliss. That's the happy, good feeling anandamide. That's the cannabinoid. So these receptors increase sexual satisfaction and help with performance and performance anxiety. As I mentioned, anandamide or bliss, that actually reduces the ejaculatory threshold, meaning it makes it easier to climax. And as I mentioned, we're talking about CBD in general, but CBD is kind of a generic term. It covers all cannabidiols, and they all have different characteristics. So there are certain products that we use preferentially. A good full or broad spectrum CBD can certainly help with performance anxiety, but when we're talking about really getting in here to sexual function and orgasmic function, CBG is my preferred cannabidiol. So it's non-psychoactive. It's not getting anybody high, but it boosts those anandamide levels. It acts as a GABA reuptake inhibitor. So we're boosting those GABA levels, and that GABA stimulates and regulates orgasm release. So here's something, again, that's very easy in terms of a recommendation to help patients. And, you might think of this as, well, this is all interesting and the science of it plugs in, but in real world applications, I've used these things. And again, this isn't a scientific study. This is my anecdotal story for you, but I've done a lot of work with military bases, and you see a lot of spinal cord injury patients that would get referred in, either veterans or still active duty. And they come in and they've had spinal cord injury, so they have erectile dysfunction. They can't get an erection. So, we get them function, whether that's using medications or like the penile injection. So they can get an erection, they can be intimate, but they have no orgasmic capacity, complete anorgasmia. And the incorporation of oxytocin and CBD products, but CBG in particular, we were able to actually see a dramatic improvement in orgasmic response for these patients. So, talk about something that's quality of life and really making a difference in your patients. This is some really intense stuff. So another factor that again, you may have patients come and report to you Peyronie's disease, or the bent banana, as you see on TV. It's fairly common. We see around 200,000 cases each year diagnosed. I'm sure there's a whole lot more that go undiagnosed. Characterization of this is, of course, the curvature or bend in the penis. A little bit more in depth, you tend to get lumps or calluses or plaques in the penis, and there can be substantial penile pain. Frequently, it's caused by repeated injury during intercourse or sexual activity, or in some cases, due to injury from other physical activity. Depending on the degree of curvature, intercourse may not even be possible. It may be difficult for penetration or uncomfortable for one or both patients, partners, if it's even possible to do so. In a lot of cases, it can resolve itself. About 13% of the time, it will resolve itself. Otherwise, we use different medications and devices and even surgical options to help patients. It's kind of a two-phase condition, where the initial phase, where you're starting to see the scar tissue form, the curvature, and starting to see the onset of the painful erections, is the acute phase. And that's usually a half of a year up to about a year and a half. And then the chronic phase sets in where the curvature has been established and it's no longer worsening. So from treatment standpoints, there are the prescription medications, but they're expensive and insurance will not cover them unless, number one, there's a palpable plaque. You can feel where that bend, where the stone or bubble or scar is there in the tissue, and there has to be at least a 30-degree curvature. Otherwise, insurance will not cover medications like the Xiaflex injection, which is a collagenase injection that softens up, it breaks down that scar tissue. Again, it's expensive. You have to get it authorized through insurance. It's an in-office procedure. It does actually require multiple injections to break down the proteins in the scar tissue. So this is something where, it's really the more dramatic cases, and you're not going to see too many patients chucking out like $7,000 for one vial for the treatment. That doesn't even include the injections. That's just the medicine. Another one that can work this way is interferon injections, because that breaks up the fibrous tissue in the plaques. But again, that's even more expensive than the Xiaflex. So it's really not, and probably would not be approved by insurance regardless. So, if we can catch this early enough and we can treat these less severe cases, there's much easier ways of going about it. Typically, in compounding, we'll actually use a verapamil cream, but doctors can also inject calcium channel blockers into the plaque. They have the ability to actually soften that scar tissue and loosen up the fibrous connections. A lot of times what we'll do with patients is we'll use kind of a combination of therapy. We'll use that topical verapamil where it's rubbed in, vigorous massage, physical massage. Think of it like trying to break down a callus on your finger. So really aggressive massage into that tissue. Sometimes we'll actually even incorporate a mild corticosteroid like a triamcinolone to reduce any inflammatory process that's going on. And, if we can interrupt the progression of that problem. Another thing that we use a lot of are vacuum erection devices or penis pumps, because, what they do is they force the penis to become erect straight. They don't allow it to bend. So you can actually physically, again, work to break down those adhesions that are in the scar and in the fibrous tissue. Vacuum pumps, if you don't sell them, man, they're a great add-on because most doctors have no idea where to get them. They're sending patients to Amazon or to, the Red Door sex store down the street. A lot of the stuff that's out there are toys. So something that's great, and it's something that you can really build up your client base and build your reputation with your medical providers. And again, it's very, very important with this because it's great physical therapy to help. A little less commonly used is penile traction. There's one in particular called a Restorex, which think of it like a penile splint that holds the penis straight. I like the pumps better because you're forcibly creating the erection and kind of pulling that tissue to break apart those fibrous connections. I did mention surgical interventions, and I'm just going to tell you that this literally and truly is the absolute method of last resort, primarily because there is a much greater chance of causing more scarring or nerve damage going in to do these types of procedures in terms of just correcting curvature. Now, for some patients, they will go the route of the penile implant, which it's a little different because there you have the ability to mechanically create the erection. It's great for severe ED, especially, guys who have kind of gone through the pathway of all other treatment options with ED, maybe medications, they can't take the medications anymore, or they've gotten to the point where the penile injections have become unreliable, or they just don't want to inject their penis anymore. The penile implants are a great option for a lot of guys in terms of end stage condition. So in summary, obviously a lot of what is in this presentation is there's so much material. I find it to be extremely important because I think that this is something there's such a high percentage of patients that we deal with that suffer from erectile dysfunction, sexual dysfunction in general. And the more information we have, the more tools we have in our toolbox to help them, I think the better off your practice is, and certainly the reputation of your practice with prescribers and patients. I know for myself that, working with patients, these are some of the most intimate consultations that I've ever had. Sexual dysfunction affects a huge population, and it's not limited. It's not just old guys. I mean, we've got young people, people in their 20s and all the way up to their 90s. And this is something that can be so detrimental to them in terms of their psyche, emotional well-being, even their physical components start to suffer because of this. So really looking into this and incorporating these different treatment options and even the diagnostic tools, even, things like supplements. We do a lot with the supplements that help the factors. We do point of contact testing for nitric oxide because it is so important to erectile function and sexual function for both men and women. And again, that's a great option. That's something that you can bring into the pharmacy. And, there's nothing like being able to do a 10-second diagnostic for a patient and show them, hey, here is a component of this condition that is extremely important. And then point them in the direction of a really good supplement where you can boost your sales, but also really help their outcome. So again, whether the ED has to do with an aging process or, other disease states or medications that are being used to treat those, whether it's from an injury or a surgery, the real goal in this is quality of life for patients, assisting them to age well. And, I have a kind of a slogan that I use, and it's called Live Harder. And that is true for not just sexual dysfunction. I know it sounds funny with ED, but in reality, what I think of as live harder is being able to really, get the most out of every day. So instead of becoming just accepting of these conditions and allowing them to dictate your level of activity, whether that's physical activity with, things like hormone therapy or sexual activity. And I really think that it's something that we can have a great influence on working with patients and build up their quality of life and their capacity for enjoyment of life. And it's something you can have a huge impact on in your own practice. And with that, let's take any questions and we can talk about how, some of these things we can incorporate into your practice and whether that's on a consultative basis using something like RX Connect.
Yeah. I don't see any questions, Greg, and I see that the participants actually, guys, if you have any questions, please put your questions in a chat box to the right. But I just want to basically touch upon, Greg, some of the things that we provide at RX Connection. One of them being the ExpediCare, which is the telemedicine for pharmacies. This is our latest program or resource for helping pharmacies build a profitable business for basically any type of a condition. And as of Monday, we are also providing chronic care management for your patients. So whether your patients are suffering from hypertension, diabetes, COPD, asthma, any other condition, you could be providing care to your patients at your pharmacy. I just want to quickly just show you some of the things that you could do at your pharmacy with ExpediCare just really quickly, because I think that's important with what Greg was talking about with all the treatments and equipments and everything else. As we all know, we need a lot of we need a prescription in order for us to dispense any medication. So what we have done with ExpediCare 24 is that we are now providing care. Let me just show you an example of a pharmacy that does have these type of resources. This is a pharmacy that just started with us yesterday. Okay, so you can see that they just started yesterday. So I can show you other stores also that started with us. So basically, they have a clinic on their website, and when they go to their clinic, it tells them that it's a virtual clinic that they can enter, and from there they can access just about any sort of a lifestyle meds or any other kind of treatment for their clients, whether it be for the tadalafil, compounded products, sildenafil, anything else, travel meds, if you're doing LDN, hair loss, and things like that. And the one last thing that I want to talk about is the Refill My Meds. This is our chronic care management. So basically, by you providing this on your website, the patients can just go in, see the doctor, click on the tadalafil troches or sildenafil tablets or whatever that medication may be, and quickly do a virtual visit with a doctor. And the prescriptions only come to your pharmacy. Let me just show you a quick patient's journey. I guess that might be something that might be helpful. So I'm just going to go into this dummy account, and I'm not sure if this is going to work. No. So what I need to do is sorry, I should have had this all ready to go. So this is basically a dummy account, RX Connection, Pharmacy, Smarts RX, and whatever. So the patients would come in and they can choose a treatment. If none of these treatments are what they're looking for any other medication. We have over 800 medications that they can get up to 7 medication refills, um, of course, with all the treatment that they have to have, lab work and everything else. So it's basically like putting a doctor's office in your pharmacy. So if I say start now, it's going to take me to a portal. I'm going to log in, and I'm going to log into a sample patient. And all of our programs are all HIPAA compliant. They're all safe and secure. It'll ask you, are you in Florida? Yes, I'm in Florida. It says select the medication. So you can start selecting the medication in here. And sorry, the Zoom call slows things down. So you just go down, and let's just say you're looking for, Advair, for example. Okay. And there you go. You just select the first one. It says that I'm requesting a 90-day supply of Advair, and I'm allergic to it. So it starts asking me questions that's relevant to the Advair, and then I want to change the medication. I have allergic to fluticasone. As you see, if you answer the wrong question, it will ask you to select another question. So basically, what you do, you say I've been on it for 6 months, and then you can upload some records of that you've had this before. Keep in mind, this is a sample environment, but the real one works exactly the same way. And you say submit your answer. Then you can go in and select another medication. I mean, if you're looking, for example, just make an example, Tegretol, for example, okay, carbamazepine, and it would ask you that upload any documentation that you have that you've been on these type of products before, medications before, goes through the same series and ask questions, and once you are done submitting all your medications, so you can ask for up to 7 medication, then you can just say confirm the reason for visit and your medication information. You put some information about your health condition, and then you just say upload and submit your answer. You consent to the treatment. I have read and understood. Confirm your phone number because the doctor will call you with any questions he may have, and you submit the evaluation. So the patient just completed a online evaluation for any medication. We have over 800 medications that the patient could ask for. And again, if it requires lab, it requires any kind of a clarification or lab work or anything else, our physician will order that for the patient. So now that I've submitted my um, request for the medication, I would come in and the doctor sees the reviews all the patient information. And if I go to my prescription, this is my pharmacy. So if I go to my pharmacy and I take a look at it, here it is. John Doe, is asking for the medication. So what do? You just click on that. You can see the patient's information. You can see the medication. And since this is a demo account, it doesn't show the actual drug. It just says Demo Med 1, Demo Med 2. And at that point, you pre-purchase visits at $39, for instance. Okay. And you have that in your bank. And then you can claim these prescriptions. So you say claim. And remember, um, you can do up to 7 medications with just one token. So at this point, you claim the prescription. It says 1 token will be deducted. You say it's okay. And now the prescription says claimed. Now, where is this prescription at? If I click on my RX right in here, prescription just gets sent to you electronically. Sorry, this Zoom is in the way. So if I go to my downloaded prescription, this is your digital or electronic prescription that was sent to you. Okay. And you can just print them. And this meets all the electronic requirements of electronic prescriptions, such as the signature, the transmission, the serial number, even we give you RX number. So at this point, you just fill the prescription and, you call the patient and collect your money. And this is one way for you to kind of keep your patients engaged and take care of them clinically. So as you see, there's a lot of potential that goes in using this type of a online clinic for your pharmacy. Now, when it comes to ED, it's the same process. You basically go into you go to your patients will end up in your clinic, and they say start now. They would answer a few questions, and the prescriptions, and there's no charge to the patient or to your pharmacy up to the point that you claim the prescription. And at that point, you claim the prescription because you collected your money from your patient. And you download the prescription, you fill it, and you give it to the patient. And through our system, you could also notify the patient that you received the prescription, it's been shipped, or it's ready to go, or what have you. So any questions here? Let me just see. Just FI cannabis are the larger category, which includes CBD and CBG as types of cannabis. CBG is not a type of cannabinoid. Okay, Greg, do you want to address this question?
I'm sorry, I didn't hear the question.
Someone's asking, just FYI, cannabinoids are the larger category, which includes CBD and CBG as types of cannabinoids. CBG is not a type of cannabinoidal. Someone's asking.
It's one of the cannabinoids. It's within, when you're looking at the full spectrum or broad spectrum, CBG is one of the cannabinoids.
Right. Okay. So with that, I think, we have on Thursdays, we have meetings. I'm not going to take any more of that time. I think Greg has done a fantastic job in the last 3 weeks and has really given us a lot of good information. And if you need to get the PowerPoint or you need to get this presentation, please write to us and we can send you a copy of this PowerPoint if you need to review it. And with that, I think this is all I have. I just wanted to show you our telemedicine program that we have that you could use at your pharmacy to improve so if you want to get into, the erectile dysfunctions and what have you. And then just if you need to contact us, you can always schedule a call. We'll be more than happy to sit down with you one-on-one and explain all the things that you can do with our program and everything else. So
And
Greg,
just as
thank
a
you.
point, yeah, just to kind of point out, Merdad, for those of you out there who are considering doing something like this, if you need any added incentive, go online and look at the programs that are available. Hims, Roman, Lemonade, Rugiet, those all have this same basis. And, those guys are charging a lot of money. They're getting paid a lot of money for doing what you can do out of your own pharmacy.
Right. Well, Greg, you made a very good point. And basically, as a pharmacist, I used to own several stores, which I sold back in 2016. This is my technology company. This is what we try to focus on, technology now. But this is Lemonade Health. And as you see, they just started trading stock on the New York Stock Exchange. So you can see how well these guys are doing. So basically, as you see, they've got the same type of a routine, whether it be Roman, Hims, Lemonade Health, and what have you. You go in and you select the treatment. And of course, they have a pharmacy. They fill all the prescriptions and they ship it to the patients, which, they're licensed, their pharmacies licensed in all 50 states. But what I want everybody to think about is, for instance, the GLP product, just not erectile. And think about the chronic care management. Just think about you can get firsthand into managing your patient's condition, and you have a doctor in your pharmacy that will, make sure the patient's interest is always at heart of everything that he does. And it's no different than going to a doctor's office. I mean, with technology these days, a doctor, a physician can be doing everything that he can do at the office except taking blood and urine. But if the doctor needs to, he can send you out to Quest Lab or someplace else so he can give some blood or, get some urine or whatever to get them all tested. But you made a great point. I mean, Roman, Hims, all these folks are taking a bite off of your profit because they're the one now. Everybody's going to Roman. And trust me, with what we have to offer, you can actually provide these type of services for any kind of treatment. I mean, we got, like I said, over 800 medications, and that's done through the cover my refill my med tab on your site, which is right in here. Okay. And
Just as an add-on to that, a piggyback to what Merdad said, something else to keep in mind is that majority of the physicians, most patients have a general practitioner or an internal medicine doc. And if you've gone to your own doctor, you know how those visits are. You've got a few minutes. They basically are sitting there looking at their computer screen. And especially if they work for a large group, they are very limited in terms of what they can prescribe. I can't tell you how often I have patients come to me where they are looking for, whether it's for alopecia, for skin cream, for hormones, for ED, for sexual dysfunction, whatever the case is. And they'll literally say, my doctor can't prescribe this for me.
Right. Right. Yeah, that's very important because, when Greg, like you said, when you go to a doctor and he comes, you wait 15 minutes in a room, comes in with the laptop or his phone or whatever. Hey, how are you? So what do you need? And he starts taking notes and putting stuff in his computer and what have you. He's basically doing the same thing, but you're just doing it face to face. This isn't any different than a face to face, except all of these treatments, all of these protocols have been written by our medical directors. We have two medical directors, and they are, they're both around 50 years of age, so they're not, 95 years old guys that writing script left and right without checking anything. They have a practice where they live, and they're doing very well. And, so this is just another, I guess you could say source of revenue for them, and they manage all of our telemedicine services. And again, this invaluable service that we provide to the pharmacies could be a great game changer in your pharmacy, because with the DIR fees, everything else, I hear every day some pharmacies been around since 1932. They're going out of business. I mean, why? I mean, that guy's been there for 100 years. And now they're closing down because they can't, because of the PBM, the DIR fees, everything else. So this will be a one way for you to improve revenue and take care of the patients in any which way for any kind of a treatment. I mean, it's not just about Viagra, like Lemonade Health or this and that, or Roman or this and that. It's about you getting involved with your patients. And another thing that I was actually talking to a group of folks last week was that, with all these pharmacies closing down, we are creating what's called the pharmacy deserts. I mean, there are about 2,200 cities across the country, 2,200 that don't have a pharmacy in their town. I mean, can you imagine that? And these are called pharmacy deserts. So, and then Walgreens closed down 600 stores, CVS store closing 900 by the end of the year, independents going out of business by hundreds. And this has created an environment which is exactly, it's ripe for these type of services that you can provide and be the beacon of help to your patients, trying to get them to come to you not only for getting medical treatment, but to get their medication, and you manage their medication. I mean, whatever you're doing medication reminder, packaging, anything else that you can add on to this, just think about all the things that you could do. So thank you, Greg, I mean, for mentioning that Lemonade Health and things like that, because that makes a huge, this is exactly how we based our business on, is just basically being able to provide services that chain drugstores can't provide at their stores.
And guys, as Mehrdad said, as these pharmacies are closing and you're seeing less and less opportunities out there in retail pharmacy, the more services that you provide
right
from your pharmacy, that is going to boost your presence. It's going to boost your footprint, not only with patients, but with prescribers, because they're going to realize what a resource you are. You're not just, counting to 30 and sticking a label on.
Yeah.
So the more you can add onto that menu of services, the better off you are on the bottom line.
Yeah. Many years ago, I used to work in a small town, and I remember how the pharmacy, it wasn't my pharmacy, it was someone else's pharmacy that I used to help out, every now and then. It was in a small town. And I never forget that, when you go there, people always coming in from all over. They call and say, hey, John, I've got this, that problem. Those days we didn't have telemedicine. And I'm just thinking that if we had these type of services at the pharmacy nowadays, think about all the services that you could provide right at your pharmacy. And you don't, it doesn't matter where the patient might be 20 miles away. You live in a rural area and the patient is 20 miles away. They call you, they say, hey, what do I do? Well, here, just go to our website, click here, click there, and we'll get the medication out to you or what have you. And and again, all these years that with the Roman and Hims and Lemonade Health, all of these, aside from DIR fees, aside from PBMs and everything else, the reason pharmacies are not seeing a lot of cash business going through their pharmacy is just that, is, a lot of these companies like Lemonade, Roman, Hims, and all those places are taking that opportunity away from your local pharmacy to provide these type of services. And now, not only we're giving you this, but we're giving you all the, chronic care management that you can offer to your patients. I mean, there are over 800 drugs in here. So, I mean, what are you looking for? Anything you want, our doctor will review all the treatments, just like go to a doctor.
And guys, I hate to keep piggybacking, but every time our dad says something, man, it spikes something in my head. What your competition out there is, these pharmacies that have the little doc in the box, the little clinics that they're out there to walk in. Those are very basic services. You go in there if you've got an earache or you've got a sinus infection, they're going to give you an antibiotic and not much else, or they're going to refer you down the road. So being able to offer a full spectrum of therapies and do so in, a very, very private and confidential manner like this puts you head and shoulders above all of those little, prescriber in the box, usually nurse practitioner or PA that's sitting in that little corner office in those big pharmacies. This is a much more comprehensive service.
Yeah. I mean, I don't know if you guys read the news last week. You know, Walmart closed down all of their health clinics, right? Walmart, you know. I mean, think about all those people going inside of Walmart, but they're closing it down. And I knew the guy that, well, I still know the guy that, was in charge of those clinics. And I asked about him and I said, hey, why are they closing it down? It's not profitable
Yep.
for them. It's to have a presence, all the staff, the employees, and everything. It's not worth it. It's not going to generate that many prescriptions from our pharmacies. Plus, our their employees, they really don't care whether the prescription goes to their Walmart or goes down the street to Bob's Pharmacy or Walgreens or CVS. They go wherever they want to go. But now you can take the lead and provide your patients with everything you need to take care of them. And you know but that's all I got. Greg, thank you again for
Absolutely.
all the last 3 weeks that you have put some time with us, and we really enjoyed everything that you talked about. And again, if you need to get a copy of the PowerPoint, please let us know, and we'd be more than happy to send it out to you. With that, if there's no other questions, I think we're gonna wrap it up, Greg. Okay?
All right.
Keep
Thanks
in
so
mind on
much.
Thursday, yeah,
Nope. Just want to say thank you again for the opportunity. And
yeah, we'll
again,
do it
look
again.
forward
We'll
to talking to you
definitely.
next time.
Yeah, this has been a great topic. I mean, we've had lots of folks that have joined us in the last couple of weeks, and quite a few people actually. And so we'll talk to you again, Greg. We
That
can
sounds
do this
good.
again. Thank you. Appreciate your time. All
Thank
right.
you, guys.
Bye-bye. Bye.
Bye bye.